So this presentation is going to be on the levels of pitting edema and how to grade pitting edema. But before we begin, we have to talk about the fact that not all edema is pitting edema. There are many different causes of edema, two of which are hydrostatic pressure and decreased oncotic pressure, which is the proteins in the blood. Both of those result in pitting edema typically. And one of the causes of non-pitting edema is a lymphatic obstruction. So the pitting edema grading scale is typically based off 1 to 4 levels. There are many different variations of specific rules that different ones can follow, but typically they are something as the following. So the 0 plus is obviously no pitting edema. Sometimes it can be referred to as 0 plus. The next level up is 1 plus pitting edema, and this is slight pitting edema. And it's hard to see. It's hard to see this level of edema without actually putting your hands on the patient. So good tip is to check for this type of edema when you're checking for pedal pulses and stuff like that. And so the 1 plus pitting edema is approximately 2 millimeters. When you push down, it's a 2 millimeter indentation approximately, and it disappears almost immediately when you remove your finger. So there's no remaining marks. So the next step up is 2 plus pitting edema. This is mild pitting edema, and the indentation is approximately 4 millimeters when you push your finger down. And different guidelines have different times, but typically it's about 10 to 25 seconds. It's a short amount of time, and it usually goes back to normal, and you can't tell that you've pushed down on the skin. So the 3 plus pitting edema is moderate pitting edema, and this is when the indentation is between 4 and 6 millimeters in depth, and this lasts for a significant amount of time, oftentimes more than 1 minute. And typically by this point, the edema is obvious to the naked eye, and you'll be able to see that somebody is edematous. So the 4 plus pitting edema is severe pitting edema. It's 6 millimeters indentation or more, and it lasts a severe amount of time. Once again, it's obvious when somebody has 4 plus pitting edema. It's obvious that they're edematous in whatever extremity that the edema is present. And the texture of pitting edema, 4 plus pitting edema, is almost as if it was Play-Doh, where you can mold and shape their extremities, because the pitting edema lasts for so long. And once again, the 4 plus pitting edema is the highest and final stage of the pitting edema scale.